Multiple sclerosis, it is an autoimmune condition that affects the brain and the spinal cord, and that can cause different neurological symptoms and, if not treated well, can lead to disability. What we know is this is a disease that affects the immune system. So the immune system is dysregulated in multiple sclerosis. And there is a genetic susceptibility and environmental interaction. And I think both of them are involved in pathogenesis of the condition. MS affects commonly younger people. In fact, it is the leading cause of disability in the US in younger people. Typical age is between 20 to 40, but you can see as younger as adolescents or even older people can also get new diagnosis of MS. Similar to any other autoimmune condition, women are oftentimes more commonly affected, almost 3 times more commonly than men. Typical presentation of MS is what is called MS attacks. So any region of the nervous system can be affected. For example, if the optic nerve, the nerve that connects the eye to the brain, gets affected, people can have pain with eye movements and gradual loss of vision. Oftentimes, the symptoms typically build over several hours or even days, reach a peak after several days, and then start to get better. A typical attack of MS oftentimes is followed by complete or incomplete recovery. Younger people tend to recover almost fully from these attacks. But if you are in the older age group and suffer an attack, there might be incomplete recovery. The second part is what we call progressive phase of MS. Oftentimes it's seen in people who had a diagnosis for 10, 15 years. They have a progressive neurological disability, typically difficulty with walking or ambulation, requiring a cane or a walker. MS, it's a spectrum. On one side, you can have a very mild form of MS where people can have almost near normal life, even athletic activities without any major issues. On the other side, people can have major disability, especially with ambulation, and may need a walker or a cane or even a wheelchair. The prognosis itself depends on a lot of factors, and predicting somebody's how they're going to do in future, it's still a big question for us. But there are certain features on patients' presentation, on their MRI scans that help us predict, and that we take into consideration while choosing a treatment. As I said earlier, the immune system is not working well. In layman terms, you can say it is somewhat overactive or hyperactive. So all the treatments are currently that we use work on the immune system. Oftentimes, this suppress the immune system to some extent, thereby you're suppressing this autoimmunity. If not treated well, some of the patients with MS can progress to what is called a progressive phase after 10-15 years of diagnosis.